Zdravlje stanovništva jedne države predstavlja veoma važan faktor koji utiče na ekonomsko, socijalno i opšte stanje društva i njegov prosperitet. Zdravlje je resurs koji nam nije dat da ga svesno biramo, ali svesnim izborima možemo u značajnoj meri da utičemo na naše zdravstveno stanje. Svetska zdravstvena organizacija zdravlje definiše kao stanje potpunog fizičkog, mentalnog i socijalnog blagostanja. Jedan od vodećih izazova sa kojim se susreće naše zdravstvo, prema podacima Svetske zdravstvene organizacije, su nezarazne bolesti, koje čine više od 80% ukupnog tereta bolesti u našoj zemlji. U poslednje 2 decenije, 2 vodeća uzroka smrti u većini zemalja, pa i u Srbiji, su kardiovaskularne bolesti, 47,6%, i maligne bolesti, 18,5%. Svetska zdravstvena organizacija procenjuje u 2022. godini da se oko 40 miliona ljudi u Evropskoj uniji leči od depresije, što je 4,3% Evropljana, dok kod nas oko 5% stanovništva pati od depresije. Zanimljivo je da je po podacima iz 2019. godine u Srbiji došlo do produženja životnog veka, pa sada kod žena taj prosek iznosi 78,1 godinu, a kod muškaraca 73,0 godina. Beleži se i porast broja prekomerno uhranjenih i gojaznih stanovnika i iznosi 57,1%, a trend svakodnevnog pušenja cigareta među osobama starosti 20 i više godina smanjen je sa 33,0% na 28,5%. I domaći i svetski lekari i naučnici ističu činjenicu da dobro zdravstveno stanje ne zavisi samo od visoko kvalitetne medicinske nege kada do oboljevanja dođe, već i od ranog otkrivanja i prevencije zdravstvenog problema. Istraživanja su pokazala da čak 60% bolesti za uzrok ima nezdrav način života. Zbog toga je veoma važno razviti pojedinačnu i kolektivnu svest da je promenom navika i redovnim pregledima dok smo zdravi moguće da sprečimo i kontrolišemo bolesti, a to je jedan od ciljeva naše konferencije Health Up. Konferencija je osmišljena sa ciljem da bude podrška evoluciji zdravlja, i to kroz edukaciju zdravstvenih radnika, debate o inovativnim lekovima i zdravstvenim kapacitetima i diskusiju vrhunskih stručnjaka o unapređenju procedura. Dame i gospodo, poštovani učesnici konferencije i posetioci, danas smo se okupili da razgovaramo o jednoj veoma važnoj temi, o zdravlju, jer zdravlje nema alternativu. Ispred više od 300 uvaženih gostiju koji prisustvuju konferenciji, te više od 40 stručnjaka panelista daće jasne odgovore na 6 izuzetno aktuelnih i važnih tema. Naše zdravlje je u našim rukama. Hvala vam što ste nam se pridružili na putu ka zdravijoj budućnosti. Dobrodošli na Health Up konferenciju.
Dame i gospodo, poštovani gosti i učesnici najveće regionalne konferencije o zdravlju i zdravom životu, Health Up, želim vam dobar dan i dobrodošlicu i, kako ja to često volim da kažem, zdravi bili. Može aplauz? Ja sam Nemanja Velikić i bit ću u naredna 2 dana na ovom mestu ovde vaš domaćin i vaš vodič kroz svet zdravlja i zdravih stilova života. Ovo okupljanje i sve što će se tokom naredna 2 dana dešavati na ovoj sceni ovde ima veoma važan zadatak da zajedno sagledamo situaciju u zdravstvu, da uz pomoć dostupnih informacija i podataka o zdravlju prepoznamo snagu i ojačamo slabe tačke našeg zdravstvenog sistema, razgovaramo o bolestima koje najčešće pogađaju naše stanovništvo i kako ih lečiti. a najveći eksperti iz oblasti zdravstva razmenit će svoja mišljenja, iskustvo, inovativne terapije i procedure i lekove koji su u primjeni, jer kao što i sam naziv konferencije glasi, naše zdravlje nema alternativu. Želim da iskoristim ovu priliku da se na početku zahvalim našim partnerima konferencije, i to zlatnom partneru, kompaniji Amicus, zatim srebrnim partnerima, kompanijama Adok i MSD, te bronzanim partnerima, kompanijama Novo Nordisk, Novartis, AstraZeneca i Krka. Danas će prva za govornicom biti i svojim govorom će svečano otvoriti konferenciju Health Up 2024 profesor dr. Sanja Radojević-Škodrić, direktorka Republičkog fonda za zdravstveno osiguranje i redovni profesor na predmetu patologija na Medicinskom fakultetu Univerziteta u Beogradu. Izvolite.
Hvala, Nemanja. Drage koleginice i kolege, poštovani gospodine Skano, poštovani i uvaženi direktori zdravstvenih ustanova, poštovani predstavnici udruženja pacijenata, farmaceutskih kompanija, uvaženi predstavnici medija. Želim da vas pozdravim i da vam se zahvalim što ste izdvojili vreme i odazvali se pozivu da učestvujete na ovoj konferenciji. Zdravlje i zdravstvo su najvažniji prioriteti Vlade Republike Srbije, jer sve drugo što se napravi, što uradimo, što smo postigli i što ćemo postizati ne je vredno bez zdravlja građana. U skladu sa tim, čak i u ovim teškim trenucima po državu, kada se kroz rezoluciju o Srebrenici Ujedinjenim nacijama pokušava da nametne krivica na ceo srpski narod, ulaganje u zdravstvo nestaju. Čak, naprotiv, su veća nego ikada. Ulaže se u sve segmente, u infrastrukturu, u izgradnju i rekonstrukciju i kliničkih centara i bolnica, kao što znate sada i primarnih centara, odnosno domova zdravlja. Planovi su da se rekonstruišu i grade seoske ambulante. Poseban aspekt trenutno je i u budućnosti na porodilištima, a isto tako podjednako se ulaže i u lekove. Kao što znate, od 2019. je revolucija u ulaganju u inovativnim lekovima i lekovima za retke bolesti, ali isto tako i ono što je od neprocenjivog značaja u našem zdravstvenom sistemu, a to su naš kadar, odnosno naši zdravstveni radnici. Ulaže se u njihovo zapošljavanje, u povećanje plate i u poboljšanje uslova njihovog rada. I kao što sam navela, dakle, ulaganje je i nastavit će se u svim segmentima zdravstvenog sistema, a ja bih radi ilustracije izdvojila 3 primera. Prvo, i ono što je najvažnije, jeste naravno budžet za zdravstvo Republike Srbije. Ove godine budžet samo Republičkog fonda iznosi 545 milijardi dinara, što je za 7% više u odnosu na prethodnu godinu, a za poslednjih 5 godina budžet je porastao čak 80%. Ako ne računamo plate, od ovog iznosa koji sam navela, najveće je ulaganje u lekove. Ove godine to iznosi 106 milijardi, što je duplo veće ulaganje u lekove u odnosu na pre 5 godina. Samo kada pogledamo lekove na recept, ulaganja su porasla za 40% u odnosu na 2019. godinu. Retke bolesti je jedan od prioriteta našeg zdravstvenog sistema i uopšte ulaganja Republičkog fonda za zdravstveno osiguranje. I da podsjetim, prvi put taj budžet je formiran 2012. godine na inicijativu predsednika Vučića, kada je iznosio 130 miliona dinara. 2024. godine, dakle samo 11 godina kasnije, budžet iznosi 7,2 milijarde sa tendencijom rasta već ove godine, dakle 55 puta više u odnosu na 2012. godinu. Taj budžet je mnogo šta omogućio, a ja ću navesti samo 2 drastična primera, da je 2012. godine lečeno 8 pacijenata, a trenutno se leči 713 pacijenata od retkih bolesti. Podsjećam da su ovo najskupi lekovi na svetu. Prosečan iznos jednog leka godišnje za pacijenta je oko 300.000 evra, a najskuplji lek je lek za spinalnu mišićnu atrofiju koji iznosi 2 miliona evra. Takođe, zahvaljujući porastu kontinuiranom ovog budžeta, od 2 retke bolesti koje su lečene samo 2012. godine, sada se leči 39 različitih retkih bolesti. Pored inovativnih lekova za retke bolesti, revolucija je u ulaganju, kao što sam rekla, od 2019. u inovativnim lekovima za sve ostale bolesti i primeri su upravo u ciframa koje iznose za stavljanje lekova na listu lekova. Ja ću navesti primer od 2017. godine. U tom periodu od 2017. do 2019. ulagano 1,4 milijarde dinara, 2020. 2,8 milijardi dinara, 2022. 5,8 milijardi i 2023. 6,2 milijarde, najveće ulaganje ikada u istoriji zdravstva. Ali ovde, kao što vidite, nije samo stvar u tome što se drastično povećava iznos koji ulažemo, već je to kontinuitet u stavljanju inovativnih lekova. Gotovo svake godine izlazi lista sa velikim brojem inovativnih lekova. Moram da napomenem da je trenutno najskuplji inovativni lek na svetu 3,6 miliona dolara, to je lek za hemofiliju, a da je pre nekih 15 godina najskuplji lek na svetu iznosio 400.000 dolara. Dakle, pre 15 godina za ovaj iznos je mogao mnogo veći broj lekova da se stavlja na listu lekova. I ne samo to, jednom kada stavite lek na listu lekova, ostaje trajno. Tako da, kada pogledamo ulaganje za sve pacijente koji se leče lekovima sa C liste, dakle samo sa inovativnim lekovima, u periodu od 2007. do 2012. godine, na primer, iznosilo je 19 milijardi dinara, a u periodu od 2013. do 2023. 135 milijardi dinara. Pa čak i ako izjednačimo isti period, da je to 10 godina, da je od 2007. do 2012. čak stavljeno 38 milijardi, opet u periodu 2013. do 2023. to je 3,5 puta veće ulaganje u inovativne lekove. Značajne sredstva se ulažu i za vantelesnu oplodnju i zahvaljujući tome su maksimalno proširena prava za vantelesnu oplodnju i ono na čemu smo zaista jako ponosni to je da smo mi država sa najvećim pravima o trošku države za vantelesnu oplodnju na svetu. Do prošle godine bili smo ravnopravni sa Izraelom, a od prošle godine na konferenciji u Španiji Srbija je proglašena za najbolju zemlju na svetu po obimu prava. Mnogo je urađeno, ali ima mnogo toga još i da se uradi. Prioriteti trenutno zdravstvenog sistema, kada je u pitanju finansiranje, jesu liste čekanja. Na tome se prethodnih meseci dosta radilo i zahvaljujući tome uspeli smo da skratimo liste čekanja za kukove i kolena na Institutu za Banjicu, gde su najduži, najveće liste čekanja i gde su najveći problemi sa 10 godina trenutno na 3. Naravno, nismo zadovoljni, cilj nam je da ove liste maksimalno skratimo na nekoliko meseci, na čemu ćemo intenzivno raditi u narednom periodu. Operacije katarakte liste su značajno skraćene od kada se ugovara sa privatnicima, ali ne samo to. Pre mesec dana Republički fond za zdravstveno osiguranje je doneo odluku da pacijenti za operaciju na kataraktu ne treba da čekaju više ni jedan dan da bi stekli pravo da odu u privatnu kliniku o trošku države i zahvaljujući tome gotovo liste čekanja za kataraktu da i ne postoje, odnosno postoje samo za one pacijente koji ne žele da se operišu kod privatnika. Drugi prioritet jeste prevencija, o čemu će najviše biti govora na ovoj konferenciji i to mi je izuzetno drago. Ulaže se, kao što znate, intenzivno poslednjih godina, a naročito od prošle godine, u prevenciju i nabavku dijagnostičke opreme. Na inicijativu predsednika Vučića krenuli smo sa nabavkom najvećeg paketa dijagnostičke opreme i prošle godine je kupljeno, stiglo u zdravstvene ustanove i počelo sa radom 18 mamografa, 10 magnetnih rezonanci, 15 ultrazvučnih aparata, a trenutno se priprema nabavka i 12 magnetnih rezonanci. Naravno, tu nije kraj. Cilj je, kao što je navedeno u skoku do 2027. godine, da se gotovo svaka opština ima magnetnu rezonancu, najveći domovi zdravlja će imati skenere, i to najsavremenije skenere za skrining karcinoma pluća. Jer, kao što znamo, maligne bolesti postaju, odnosno poprimaju razmere epidemije. Naravno, ne kao poslednji prioritet, već kao najznačajniji prioritet jeste vi, zdravstveni radnici, kadar. Tu imamo probleme ne samo u broju zdravstvenih radnika, već ono što definitivno na čemu moramo da radimo jeste na vašoj edukaciji i to ne samo edukaciji u novim metodama, novim znanjima, razmeni sa kolegama iz inostranstva, ali isto tako i u našoj zemlji, već i na edukaciji komunikacije. Na edukaciji komunikacije kako između vas i nas državnih institucija koji treba u svakom momentu da budemo tu za vas, da vas podržimo i pomognemo, ali isto tako mislim da moramo ozbiljno da radimo i na edukaciji sa pacijentima. Ono što mi kao država radimo i nastavit ćemo intenzivno da radimo jeste da povećavamo broj zdravstvenih radnika, naročito akcenat moramo da stavimo na mlade. Meni je jako drago što se oni dosta angažovali. Evo, juče je otvorena jedan kongres mladih zdravstvenih radnika kojima smo se takođe obratili. Žao nam je što zbog ove konferencije nismo sa njima, ali se nadamo da ćemo to biti sledeće godine. Takođe, intenzivno se dodeljuju specijalizacije, povećavaju se plate i nastavlja se povećanje plata. Podsjetit ću vas da je 2012. godine prosečna plata lekara iznosila 596 evra, a 2024. godine iznosi 1259 evra. Prosečna plata medicinske sestre 280 evra 2012. a 2024. 680. Naravno, na ovome se intenzivno radi i nastavljamo sa povećanjem plata. Cilj ove konferencije i ovog našeg okupljanja jeste da kroz kvalitetnu diskusiju najboljih stručnjaka, kroz lična iskustva i različita mišljenja vidimo šta je dobro, šta bi moglo da bude bolje u svakoj oblasti. Ne samo kada je u pitanju uža struka, već i kada je u pitanju finansiranje i sve drugo što mislite da treba da otvorimo kao temu na ovoj konferenciji, a ujedno i da građanima razjasnimo neke nedoumice koje imaju i podstaknemo ih na preventivne preglede, što je prioritet ne samo zdravstvenog sistema, već i ove konferencije, kao što je najava da zdravlje nema alternativu, jer zahvaljujući savremenoj dijagnostici, savremenim aparatima, savremenim terapijama koje nastavljamo da stavljamo na listu i da budu dostupne, cilj je da ne postoji inovativni lek u regionu koji nema Srbija. Mnoge bolesti, kao što znamo, mogu da budu izlečene ili mogu da budu pod takvom kontrolom da pacijenti sa takvim bolestima žive kao pacijenti sa dobro kontrolisanom bilo kojom drugom hroničnom bolesti. A uslov za sve to jeste da se dijagnostikuje na vreme i da se dobije terapija na vreme. Još jednom želim da vam se zahvalim na učestvovanju na ovoj konferenciji, da vam poželim konstruktivnu diskusiju i prijatan boravak ovde na Zlatiboru, a ono što moram takođe da kažem jeste da mi je izuzetno drago što je ovo prva konferencija u kojoj učestvuju svi iz lanca čitavog zdravstvenog sistema i to podjednako ste zastupljeni i da su teme podjednako zastupljene, kako usko stručne, tako i teme iz finansija, teme iz preventive i sve ono što je trenutno aktuelno. Još jednom hvala vam i želim vam sve najbolje.
Veliko hvala profesorki i doktorki Sanji Radojević-Škodrić, a nakon otvaranja sada je vreme i za uvodno predavanje. Čast mi je i zadovoljstvo da je sa nama danas i da će na uvodnom predavanju govoriti dr. Fabio Scano, predstavnik Svetske zdravstvene organizacije i šef kancelarije u Srbiji. Izvolite.
Dobar dan. Živi i radim u Beogradu, ali moj srpski je loš. So I guess it's better to go ahead in English, but since I'm planning to engage you in my talk, may I ask you to raise your hand if now you understand what I'm saying in English? Good number. So, let me put it frankly and thank Sanya for inviting me, and I see that there are also other friends in the audience. Bad health and, let me see here, just a second. Bad health and unhealthy health behavior are bad for the economy and are bad for everyone. We know this. Alcohol consumption, tobacco, pollution, they are all a major loss for the economy because of the lives lost, but also of loss of productivity. Let me be frank, and you already know it. 8, 9 out of 10 people in this room, including myself, will either suffer or die from a non-communicable diseases, be this heart condition, respiratory chronic condition, diabetes, or stroke. So the point is that we really need a major shift from curative service that they save lives to preventive service to avoid to get there. And there is a lot of work to be done there. What I will do today over the next 15 minutes is to walk you through a very powerful economic argument on why this should be done, both in terms of contribution of the health sector on the country's economy to make you proud of how, as an health sector, you contribute to your country's economic growth, but also in terms of an economic argument why investing in prevention of non-communicable diseases is the smart and only choice to go. I'm not an economist by background, but I'm a curious person, so I hope to trigger your curiosity so that you will see health and also prevention to non-communicable diseases in a different way. But the main objective to trigger your curiosity is to draw your attention away from your mobile over the next 15 minutes and glued to the presentation we are going to walk through together. I start with one figure and only one, and it's 2.36 billion euro. That is the output of the health sector for 2021 in Serbia. This economic analysis is done doing and using economic parameters such as input-output tables and multiplication exercise. Don't worry, I will explain what it is for whoever is not an economist like myself. And we are using country data from 2021. So it's about you, it's not about something that is foreign. So 2.36 billion, and in the pie chart, you see the subdivision and how much there is a contribution in terms of added value. Added value is productivity, and you will see that productivity is one of the major contributors of the health sector to the country's economy. What is productivity? I make it simple. In the health sector, there are a lot of machines, X-ray, blood test equipment, MRI, you need to change them, so you need to produce new ones. And another thing that impacts productivity a lot is the wages, is the salary. And the health sector is a major contributor of income for the country. So that's why productivity is so high. Throughout the presentation, I will compare the health sector to the other 62 sectors that contribute to the country economy. I will highlight the top performer when it comes to productivity is, of course, the construction second, the lowest performer, but also I will pair health sector with education, because generally those are the sectors that in the mind of the citizen are those that where the money goes into, but you never see them as generating wealth. And this is a wrong assumption. And I will also compare with two of the sectors that are thought to be the engine of the economy. That is computing and IT, that is called CPCS, and the food industry. So let me tell you how good you do as health sector in the country among the 62 sectors. You are 9th in terms of added value, which means productivity. You rank 10 in terms of job generation, not only within the health sector, but we will see later, across the society. And you rank 13 for income of employees. These are all indicators that are crucial to the economist when it comes to inclusive growth. And the health sector tops among the 10 in Serbia for this. I hope that you are trying and starting to see how much the health sector contributes to the economy of the country. So when it comes to a comparative analysis, we see that the health sector is ranking 3rd in terms of added value and is ahead of sectors that are meant to be the engine of the economy, such as food industry and IT. But what are the economic and household benefits? Because at the end, what matters is what gets to the people in the community. How much wealth is generated for the people in the household. This is also a characteristic of the health sector, that is wherever it's present, whether it's in Belgrade or is in a municipality, Zlatibor or another one, it generates wealth, unlike other sectors like IT that generates wealth generally in the capital. So there is this geographical equity of the health sector in terms of generating wealth. So the exercise that he uses, the multiplication, basically is you put something in the health sector and how it triggers and multiplies the effects throughout the society. In economics, it's called the multiplication exercise. The typical example, basically, is consumer spending. If you change a factor in consumer spending, you increase productivity because you need more goods, so you increase labor and you increase wages, and so you increase again spending, consumer spending. It's like a cycle with rippling effect across the economy. But when it comes to the health sector, the multiplication happens in stages. First is within the health sector itself. Then it has effects on the supplier of the health sector, that is the direct, then on the suppliers of the suppliers. So it has also indirect effects, and last but not least, and is the most powerful one, on the household itself. Another added value of the health sector compared to others is that it does not prefer selected niches of the population or groups. The wealth is distributed equally across the society. Let me drink, please. So, if you're an economist, you understand the power of the number, but we cannot go through each one of these, so I will just highlight a few for your consideration. These are the effects on the health sector itself. If I put 1 million euro into the health sector, what do I get? I get an income of 0.38 million, which is a major one. So basically is the increase of a salary in income of the employment, which is a major thing if you're in the government and in the Ministry of Finance. And if you are looking compared to other sectors, you are doing 4 times better than the food industry that is meant to be a driving sector of the economy. Listen, I'm not putting the IT sector and the food sector here to bash them. I'm putting them to make you realize that that the health sector is not the child, the minor child, but is a major contribution to the country economy, and for the economists to look at it in that way, you have to be the first one to look at it in that way. Let's move on and we look at the effect that we have on the supplier of the health sector that are called the direct effects. It still generates wealth among the suppliers with, again, 320,000 euro of output. So that the output is the wealth that the sector generates. And this is for 1 million to put into it. If we compare to the other sector, we see also the education sector that does good in the sense of generating output and not only being a cost of an expenditure. That is the word that is always associated when you talk about the health sector. Let's see the indirect effect, and these are the suppliers of the suppliers. So we are really rippling down and seeing this domino effect across the society on how much the health sector contributes. And here we have productivity. Remember what productivity is. It's a crucial economic indicator for the economic growth of the country. When it comes to this, look at this. It's even similar to the IT in terms of productivity. So we don't have to shy away when we say that we do indeed contribute to the economic growth of the country. Last but not least are the induced effects, and these are the effects on the household. I can tell you that while the economist was doing the analysis, they were surprised themselves by the results. Why? Because it appears that the health sector contributes to job generation in the household. These are not jobs within the health sectors. These are jobs within the community, the people who live in the household. And when you compare this with, for instance, the IT sector, you see there is more of the double. This is a national analysis, so it's a snapshot across the country. What we are going to do this year is the analysis in each municipality. So we will see how much the health sector is a driver of your country economy when it comes to the municipality where you are from. You're not all from Belgrade, I hope, or where you are from or where your community is from. To sum up, basically, you have seen that for 1 million to put into the health sector, there are major advantages in terms of productivity, in terms of job generation, and in terms of income. And this is all crucial for inclusive growth for the country. But let's make also the opposite argument. Let's take 1 million euro out of the health sector. What would you think? First thing, patient will suffer because services are not available. And this is what the health people we keep telling the politicians and also the economists. But I'm telling you even more. For 1 million that you take out, you are compromising the economic fabric of the country because you are impacting on job generation at household level, you are impacting on added value and job income throughout the fabrics, economic fabrics of the country. So there is also this very powerful argument that you could be proud of, that we are not only saving lives if you're working with the patients, but at the same time, we are contributing to the economic growth of the country. Let me now move on and make the link of how much money are we talking about and how much investment there is in the health sector. According to WHO, in terms of expenditure, countries should have 6-8% at least of the GDP in health. Serbia is more, is about 10%. These are only numbers. There is a steep increase between 2018 and 2021. The latest data from 2021, maybe due also to the construction of a hospital when it was in 2021. But it's not very much on how much is spent. And to give you a comparison, countries like the United States, they spend 16%. It's not that the more you spend, the better you are. It's a matter of efficiency, and it's a matter where you put the money. So we still have the time to think, how do we want to spend the taxpayers' money? And the current structure of the expenditure, you see it on the other column. And you will see the difference between how much is put into curative service, 2.4 billion in terms of expenditure, compared to preventive services, that is 181 million. In addition, over the years, from 2018 to 2021, curative service expenditure has risen from 1.6 billion to 2.4. These are pros and cons. As Sanja was saying, access to drugs has increased dramatically in Serbia for rare diseases, but also for HPV, that you have been the first country in the world, in Europe for sure, the 53 countries in the world, I also think, that offered HPV vaccination to prevent cancer, cervical cancer for women, but other cancer for men in the future generation, to both boys and girls. The majority of the countries, they only offer that for girls and not for boys. Major advancing in accessing novel drugs and cancer drugs. Don't get me wrong, drugs save lives, but it's also true that we have to avoid to get to that stage. Look at the crowd. What are we? A bunch of people in their 40s, 50s, some outliers in the 60s, some outliers in the 30s, the lucky one in the 20s, okay? So, put me straight. Every single woman in this audience, 45 and older, should have a mammography. This is not something that should even be discussed, because prevention is much more effective than an early diagnosis of breast cancer than of course, going through a painful exercise in chemotherapy that is crucial because it saves your life. HPV vaccination, again, prevents something that we didn't have as children of our generation. Doesn't have anything to do with sexual education at school. Nothing. It gives the option, because it's the most effective when you are an adolescent or pre-adolescent, for our children to be cancer-free in the future. Something to massively invest on. But it's not here that we stop. We have to go ahead. So, let me tell you that also in Serbia, although it's doing much better than in the past, there is quite a lot of out-of-pocket expenditure, and is one of the highest in the sub-region. Again, it's improving, and we are working, and we're more than happy to continue to work with Sanja in the future to have a policy for financial protection of patients to even decrease this out-of-pocket expenditure. Because if people don't spend out-of-pocket for medicine, they will spend for the economic growth of the country. So you see that the topic is quite articulated, but we have always to look from the patient perspective so that they don't go into catastrophic expenditure when they access health services. And a lot of these, unfortunately, go into medicine. And all in all, there is 1.2 billion out-of-pocket expenditure in the country per year that is on medicine. Major advancement in the countries to access the newest medicine, but it is also to be balanced for financial protection for patients. Medicine don't have necessarily to be for free, but definitely patients shouldn't go into catastrophic expenditure, and the household shouldn't replace medicine for bread or for essential commodities going forward. Let me tell you the power of prevention. And I take it from an economic argument, because if I make a health argument, it's always the same thing. It's health people talking to health people on how good prevention is to save lives, and it's true. But let's put it that this was on the New York Stock Exchange. Tell me if I'm wrong. I put $1 in, and by 2030, I get $7 out. And in the meantime, globally, I save 7 million people. Would you invest in it? I'll go right away for that. As an investor, not only as an individual. It makes an economic sense to invest in prevention. Changing behavior of the people is one of the most difficult things that you can do. We will talk about smoking later, don't worry. I won't leave this room without talking tobacco control. But in general, also in terms of healthy lifestyle, especially if you have had that behavior for years and years and years, to eat the burek in the morning, at lunchtime, and in the evening, to reduce for your children the consumption of burek and make a good one and not one with processed trans fat that is available in the store, is taking commitment, individual commitment. I'm 2 slides away, so I'm about to finish, but these are very powerful slides that I want to share with you. This is a breakdown of the 16 best buys for WHO, and it's an economic one. If you invest in this is the return that you will have. And I start from a personal experience, because whatever touches us personally is the powerful driver to change behavior. And I start with managed cardiovascular disease and diabetes. $1 in, $3 out. I have a monitor. I have an heart monitor for 4 days. Because over the last 6 months, I started having blood pressure that I'd never had before, and 3 treatment regimen is not coming down. Don't worry, it's not that high. So we decided to manage it, not to go in the future, and I hope not, into a bypass surgery, because that is what I don't want. But I cannot go only for managing my cardiovascular diseases. I have also to do a healthy lifestyle, and I have to do physical activities. So I committed myself to do at least 3 times a week, to go to the gym or to walk for 40 minutes without thinking about work, without thinking about things that stress us. You can have any stressor: family, children, parents, work. You have to take care of your mental health. So you see how I move from institutional commitment to invest into prevention to individual commitment to invest into prevention. Because at the beginning of everything, it's always you. You can have a New Year's resolution that I will eat better next year, but then you don't do it because behavior are hard to change. What we provide as WHO is the science behind the changes that needed to be done. But then it's also an individual commitment to make those changes. Here you have the economic argument to make them. So please, you know that you can do it as I'm doing it, and so you have both the economic argument and the individual argument for going forward. Last topic, as I said, I was not going to leave the room without making the argument of tobacco. Why? Because Serbia has the highest consumption in the European region. I'm coming from 12 years of China, where consumption is 50% and the overall consumption is 32%, and where in 2017 we introduced smoke-free hospitality sector starting from Beijing. I'm sorry, 20 million people. So only Beijing, and then to expand to the rest of the country. Guess what? People loved it. And guess what? Ipsos, your Ipsos, you all know Ipsos, did a survey in March, and 75% of the Serbian population wants a smoke-free low total in indoor places. This is the majority of the smokers and almost 90% of the non-smokers. And guess what? Rural, people living in the rural area, they want it even more than the people living in the urban area. There is an overwhelming support for a smoke-free law in the hospitality sector. And going forward, you have Expo 2027, the ambition of the country, the image that you want to give of the country. That image should be a smoke-free Expo 2027. It cannot be an expo with the smoking indoor. So I'm at the last slide. There is the investment cases for tobacco, where the data of 2019 right now is using up 4.9% of the GDP. And these are the cost of tobacco consumption to the country. And you see that 19,000 people died from tobacco-related causes due to tobacco. If you invested in the tobacco intervention, you'd save 642 billion RSD by 2035. Let me conclude with this last slide. I hope that I've triggered your curiosity, and now that you see health in a different way, but also that you see how to do prevention for non-communicable diseases in a different way, from a personal perspective, but also as an investor, how you like your country to invest into it. And I'm doing this slide on purpose, because these are our children, are 11 years old children. The best investment that you can do for the economy and for the country is for this generation, how it grows, to be 100% smoke-free. I hope that you enjoyed this presentation as much as I enjoyed sharing with you. Hvala.
Poštovani gosti i učesnici panela, mislim da je sada vreme za jednu kraću pauzu, kao i za kolege iz medija koji mogu uzeti izjave na press wallu ispred sale, a mi se na ovom istom mestu vidimo za tačno 15 minuta.